Welcome to my channel Medicine Guide. Digoxin is a type of medicine called a cardiac glycoside. It's used to control some heart problems, such as irregular heartbeats, arrhythmias, including atrial fibrillation. It can also help to manage the symptoms of heart failure, usually with other medicines. It's normally recommended when these other medicines have not been enough to control your symptoms on their own. It works by slowing down your heart rate and making your heart beat more strongly, which makes it easier for your heart to pump blood around your body. Digoxin is only available on prescription. It comes as tablets and as a liquid, sometimes called an elixir. It can also be given as an injection, but this is usually done in hospital. In this video we will discuss mechanism of action, indications, uses, side effects and other pharmacology of digoxin. So let's start our discussion. But before that, please subscribe to my channel Medicine Guide. So let's start with mechanism of action. Mechanism of action. Digoxin inhibits sodium-potassium ATPase, which in turn causes increased availability of intracellular calcium in the myocardium and conduction system. Inotropy and automaticity are subsequently increased while conduction velocity is reduced. Therapy indirectly causes parasympathetic stimulation of autonomic nervous system, with consequent effects on the sino-atrial (SA) and atrioventricular (AV) nodes. Digoxin reduces catecholamine reuptake at nerve terminals, rendering blood vessels more sensitive to endogenous or exogenous catecholamines. Increases baroreceptor sensitization, with consequent increased carotid sinus nerve activity and enhanced sympathetic withdrawal for any given increment in mean arterial pressure. At higher concentration, increases sympathetic outflow from the central nervous system, CNS, to both cardiac and peripheral sympathetic nerves. It also allows progressive efflux of intracellular potassium, with consequent increase in serum potassium levels. Uses of digoxin. Here are some of the common uses of digoxin. 1. Atrial fibrillation and atrial flutter. Digoxin is often prescribed to help control heart rate in individuals with atrial fibrillation and atrial flutter, which are irregular heart rhythms. It can slow down the electrical signals in the heart, helping to regulate the heartbeat. 2. Heart failure. Digoxin is used in the treatment of congestive heart failure, a condition where the heart's ability to pump blood is impaired. It helps the heart pump more effectively, improve symptoms, and reduce hospitalizations in some patients with heart failure. 3. Supraventricular tachycardia. SVT. Digoxin can be used to slow down the heart rate in certain cases of supraventricular tachycardia, a rapid heart rhythm that originates above the heart's ventricles. 4. Paroxysmal atrial tachycardia. PAT. Similar to SVT, digoxin can be used to treat paroxysmal atrial tachycardia, another type of rapid heartbeat originating in the atria. It's important to note that digoxin is not a first-line treatment for all heart conditions, and its use depends on the individual patient's medical history and specific heart condition. Additionally, it must be used carefully and under the supervision of a healthcare provider because it has a narrow therapeutic window, meaning the difference between a therapeutic dose and a toxic dose is small. An overdose can be dangerous. Patients taking digoxin should be closely monitored, and the dosage should be adjusted as needed to maintain a therapeutic effect without causing toxicity. Toxicity symptoms can include nausea, vomiting, visual disturbances, and cardiac arrhythmias. Warnings. Digoxin is not suitable for some people. To make sure it's safe for you, check with your doctor before you start to take digoxin if you have ever had an allergic reaction to digoxin or any other medicine. Serious heart problems such as cardiomyopathy, Wolff-Parkinson-White syndrome, heart block, pericarditis, myocarditis, or you have recently had a heart attack. Kidney problems, an overactive thyroid, hyperthyroidism, or an underactive thyroid, hypothyroidism. Changes in how the thyroid works can affect how digoxin works. Stomach or bowel problems, such as Crohn's disease, or if you have had surgery on your bowel or stomach. These can affect how much digoxin gets into your body and may change the dose of digoxin you need. Lung disease or severe asthma. a rare hereditary problem of galactose intolerance, including the LAP lactase deficiency or glucose-galactose malabsorption. Beriberi disease, also known as thiamine deficiency, a low blood potassium or magnesium level, or a high blood calcium level. Like all medicines, digoxin can cause side effects. Some people are more sensitive to the effects of digoxin than others. These include children, older people, and people with kidney disease or an underactive thyroid, hypothyroidism. Digoxin is safe to take as long as the benefits of taking it are greater than the risks. Your doctor will help you decide this. Common side effects. These common side effects of digoxin happen in more than 1 in 100 people. There are things you can do to help cope with them. Feeling dizzy. Feeling or being sick, nausea or vomiting. Diarrhea. Changes in your vision, including blurred vision and not being able to look at bright light. Skin rashes. Important. Tell your doctor if you have more than 2 of the common side effects. It means you could have too much digoxin in your blood. Serious side effects. It happens rarely, but some people have serious side effects after taking digoxin. Serious allergic reaction. It's possible to have a serious allergic reaction, anaphylaxis, to digoxin. Contact to your doctor. That's a no for this video. If you want to watch more videos like this, please keep watching my channel. Disclaimer. Channel's intention is to make sure that its consumers get information that is accurate, reviewed by an expert and error-free. However, the information mentioned here should not be used as a replacement for the advice of a qualified physician. The information given here is for informational purposes only, which may not cover all possible precautions, side effects, contraindications or drug interactions. Consult your doctor and discuss your queries related to any medicine or disease. Thank you for watching the video. Please do not forget to like, share, and subscribe to my channel Medicine Guy.